This is a Fox 5 News special report.
Good afternoon, I'm Phil Blauer, and happening right now, San Diego County leaders are providing an update on the coronavirus situation here. Let's go ahead and listen in.
In the beginning, our nation didn't have enough testing supplies, and we were very careful about not using up all of our tests and limiting it to the people who really needed them. Over the past several weeks, we've been able to increase our testing to the point where now, over the last 14 days, we've been able to average over 8,000 tests per day. However, as positive cases have surged throughout the country and demand has significantly increased for more testing by public agencies, hospitals, and clinics, it has led to a national and global shortage of testing materials, which is impacting us here locally also. We do have some good news to share with you today. We've come into an agreement with a local company that you're going to hear from in just a few minutes that will help stabilize our supply chain. But we must remain careful with these supplies. As a result, we will be modifying our testing approach a bit to focus more on priority groups like healthcare workers, first responders, and other at-risk groups for the time being. We will hear more on this subject from our Health and Human Services Agency Director, Nick Mascione, who also leads our county's T3 strategy. We'll hear from him after we get through the regular updates. To get us started, let me call on Supervisor Nathan Fletcher to go through the numbers.
Thank you, Chairman Cox. The number of COVID-19 cases are surging throughout the United States, and San Diego and California are certainly no exception to this rule. The potential for uncontrollable and exponential growth that could overwhelm our healthcare.
Is undergoing.
How's that?
All right. You guys are good. I'll buy you an ice cream.
Okay, obviously right now you're seeing Supervisor Nathan Fletcher as he's trying to go over some of the statistics involving the COVID-19 situation here in San Diego County, but they are having audio problems. This is on the county's end, so hopefully here they'll get that fixed as soon as possible. You can actually see the interpreter on the right-hand side of your screen. She has given up, so now he's going to be checking his audio inputs here. He did start fine, and all of a sudden this just stopped about a minute or so ago, so we're going to see if he's going to be coming back on here any minute, or if they're going to go back to Chairman Cox, back to the County Operations Center. Again, this is San Diego County live here, bringing us up to speed on the briefing. Let's go back to Chairman Cox right now.
We're having a few technical difficulties. We'll go back to Supervisor Fletcher in just a couple of minutes. But to give us the Public Health Director's report, let me call on Dr. Wilma Wooten.
Thank you, Chairman Cox, and thanks everyone for attending today's briefing. As is our practice, global, national, and statewide statistics are based on data that is obtained from the Johns Hopkins dashboard and was obtained today around noon. Based on reports through 11:59 p.m. yesterday, the County of San Diego is reporting its stats as follows. There are 20,348 cases, which is 419 more cases than yesterday. This includes a total of 422 deaths, with no new deaths reported since yesterday. The age range is unchanged, 3 months to 102 years of age. In making this essential milestone of breaking the 20,000 threshold for cases, I would like to just clarify who is actually counted among our positive cases, as there have been many unfounded rumors in social media. I'd like to stress that only laboratory-confirmed diagnostic positive tests are counted in our daily count for positive COVID-19 cases. The case total does not include suspect or probable cases or people that are on home quarantine unless they have been tested. And those people that are on quarantine have been exposed to a confirmed positive case. None of the latter individuals are included, again, in our laboratory-confirmed diagnostic tests. The number of confirmed cases that we report daily are just that, laboratory-confirmed cases only, and this is the recommended practice in the state of California. Also, the case definition is defined by the Council of State and Territorial Epidemiologists, and at our recent board meeting last week, there was a public comment which stated that I had changed the case definition. So I wanted to take the opportunity to clarify that that was an inaccurate comment, maybe a misunderstanding, but we have not changed the case definition. So continuing, there are 11,767, or 58% of the cases between the ages of 20 to 49 years of age, and again, this is slowly increasing. The gender is about the same, 51% female, 49% male. We have 2,052, or 10% of the total cases have been hospitalized. 538 of the total number of cases have been admitted to the ICU, and this is 3% of the total number of cases and 20% of the total number of those individuals or cases that have been hospitalized. Regarding deaths, there are 422 total deaths, which represent slightly over 2% of the total number of cases. 186, or 44%, are female, 236, or 50%, are male. And 95% of those individuals that have unfortunately died had underlying medical conditions. As with positive cases, deaths attributed to COVID-19 are also included in the total number of cases, hence they are also laboratory-confirmed positive cases only. Our sympathies and condolences go out to the families of all of the individuals that have been identified as deaths due to this pandemic. And all of our information is found on our county's website, which is found at the bottom of most of our slides and on the sign in front of you. Now, let's quickly move to the results for today's 13 triggers. 3 of these triggers are abnormal. And you will see here triggers number 1, number 2, and number 11. In the next slide, we will start with trigger number 1, which is based on case rates. And as you can see, we are still abnormal, even though it's decreased slightly from yesterday. Basically, because of this elevated case rate, we are still on the state's county monitoring list. Next slide. So this next slide shows for the past 7 days the number of outbreaks, community outbreaks, and the metric here is no more than 7 outbreaks over the past 7 days. And as you can see here, our total number of outbreaks for community settings in the past 7 days is 17. In the next slide, it breaks out, and actually the next 2 slides, this one as well as this one, thank you. It shows the various settings or locations where these community outbreaks are located. And as you will see in the next slide, this shows the most recent, ranging from restaurants and or bars to businesses as well as healthcare settings. And in this next slide, this aligns with trigger number 11, which is related to case investigations, and this is due, by and large, due to the increasing number of positive cases that are reported on a daily basis. So we are mitigating this by bringing on more case investigators. We actually were on an upward trajectory since July 5th, but over the last 2 days are declining slightly, but we do have mitigation plans in place, including hiring more staff and bringing on additional surge staff as well as temporary expert professional staffing. And in this last slide, I just want to remind everyone that it is important to understand that the pandemic is not over. The virus is still in our community and it is widespread. And we cannot emphasize enough that the actions that are listed on this slide are very important for curtailing or preventing COVID-19, and these include practicing good hand hygiene and sanitation, maintaining 6 feet separation, wearing facial coverings, avoiding crowded places, and staying at home if you are sick, and not gathering. So we encourage you to continue to practice these guidelines. It is with this and the actions that have recently been taken by the governor that we will get on the other side of this pandemic. Now, please welcome back to the mic Chairman Greg Cox. Thank you.
After a few glitches, we're going to try to go back to Supervisor Nathan Fletcher to go through the numbers. So, Supervisor Fletcher, let's try it again.
All right, thank you, Chairman Cox. Hopefully, you all can hear me now. Before we get to the numbers, we want to walk through a few things related to the governor's action today, along with the air quality situation as it relates to the fire aboard the naval vessel, and then just reemphasize the changes that are coming in surrounding testing. The number of COVID-19 cases are surging throughout the United States, and San Diego and California are certainly no exception. The potential for uncontrollable and exponential growth is certainly what we are trying to avoid. An overwhelming of our healthcare system would not only be the situation that we are desperately working to not have happen, but would also have tremendous economic distress on our local economy. And so that puts the state of California and San Diego County in a position to need to take additional actions now. One of the most challenging aspects of dealing with the coronavirus pandemic is the reality that you have to often take actions and steps before it is painfully or plainly obvious to you that you need to. If you wait until your healthcare system is overwhelmed, by that point, it would be too late. And that is why we have the metrics around cases, outbreaks, percentage of positives, and others that we share daily. Those are the metrics that we use in conjunction with the state of California to guide the difficult decisions that are being made statewide. And that's what's pushed the state of California to re-examine the indoor higher exposure settings that are highest risk. We saw the governor today taking action to try and slow the spread throughout California, in particular in the most impacted counties, those on the state's monitoring list, which includes San Diego. So in addition to reimposing some restrictions to try and slow the spread of COVID, we are also confronting the realities of challenges in our testing system based on both the increase in positive cases and global supply chain shortages that are impacting many jurisdictions throughout, that cause us to refocus our prioritization on testing moving forward. So let's start with the governor's action today. Today, Governor Newsom announced the closing of indoor operations in high-contact, longer-duration sections for counties like ours that are on the state's monitoring list. Because we are on the list, we have to adhere to the closure of indoor operations in the following sectors: gyms and fitness centers, places of worship, office settings for non-critical, non-infrastructure sections as identified on the website covid19.ca.gov, personal care services including nail salons, massage parlors, and tattoo parlors, hair salons and barbershops, and indoor malls. These entities must cease their indoor operations, and that will be effective at midnight on Tuesday night, so effective on Wednesday morning, and those statewide restrictions will be in place until further notice in counties like ours, which are on the state's monitoring list. The governor also made the previous statewide restrictions that we've already been subject to applicable to all counties in California around bars and restaurants. But they did, if we remember when we put in place the statewide imposed restrictions around bars and restaurants, it was for a 3-week period of time. Those have now been changed also until further notice. And so indoor operations, gyms and fitness center, places of worship, office settings for non-critical infrastructure sectors as identified at the state website, personal care services, nail salons, massage parlors, hair salons, and barbershops and indoor malls must all cease their operations starting Wednesday morning per the state of California guidance, and that will be in place until further notice. For those business owners and employees who are there, we feel tremendously bad about having to be put in this situation of starting you up and then having to limit your operations. Rest assured, I don't believe that anyone takes any of these steps lightly, and it is with a great sense of understanding that if we don't retain control of the spread of coronavirus, it threatens the entirety of our economy. And so these are unfortunate steps, steps that we're certainly going to have a negative economic impact on your business, but the things that the state of California believes we must do in order to rein in control of the spread so that we can hopefully resume and be in a good position moving forward. As Chairman Cox mentioned, the surge in positive cases is also impacting our testing situation. We have more sick people. We have more positive cases, which means we have greater demand on our testing system. That is being compounded by a global supply chain shortage with testing supplies and components. There's been an unprecedented run on the components and types of pieces that go into making these tests, and multiple jurisdictions throughout the world, but in particular throughout California and throughout America, are experiencing unacceptable delays in the time it takes to get an appointment, and unacceptable delays in the time it takes to get testing results. These delays negatively impact our ability to effectively contact trace. Testing is a key part. Testing, tracing, and treatment is a key part of our strategy to try and mitigate and slow the spread of coronavirus. And so because of this, many counties throughout California are shutting down testing sites. Many are closing existing appointments and reservations that have been made in order to try and reduce the number of tests they're doing to speed up the pace at which they can get those results and to reprioritize and focus on the highest priority folks in order to get testing. Because of the partnership we're announcing today with Helix, adding in 2,000 tests a day with a 24-hour turnaround, and you'll hear from their CEO, Mark Stapley, in a few minutes about this arrangement and what they're doing. But because of this effort, we are not having to cancel our appointments, and we're not presently having to cancel any of our testing sites, but we are shifting our priority. And so for new appointments being made, those will be focused on individuals who are symptomatic or individuals who are asymptomatic that fit into some of our priority groups like healthcare workers, first responders, those with chronic or underlying health conditions, or those living in long-term care facilities. And so by taking this approach to reprioritize our focus on symptomatic folks and asymptomatic folks who are in the settings I just described, we might see a reduction in the number of tests being done, but we do hope we can see an increase in the speed at which we're able to turn around those tests. Lastly, before we jump into our charts, I just want to share, everyone in San Diego is aware of the fire on the naval vessel in San Diego Bay, and our thoughts go out to the firefighters, the crew, to those that have been injured, and our heartfelt appreciation to all of those who are trying to contain the spread of this. It is never good to breathe smoke, and members of the public should assume that they are being impacted if they smell smoke or if their eyes are burning. The particulate matter from the fire as well can be a compounding factor for those who have or are at greatest risk of contracting COVID-19. Anyone with underlying health conditions such as asthma, those with symptoms, or even people who are asymptomatic, we encourage you to take extra precautions. At this time, our Air Pollution Control District is recommending that residents who smell smoke remain indoors with the windows and doors closed and to reduce physical activity to the greatest extent possible. The San Diego County Air Pollution Control District is working with our federal partners and the Navy to collect and analyze air measurement data at several locations, including Sherman Heights, Mountain View, Chula Vista, and El Cajon. And we are working both with our own monitoring along with their monitoring to record levels of airborne particulate matter from the smoke at a downtown air monitoring station at Sherman Elementary. The monitoring that's been done thus far is not demonstrating toxic chemicals, but the smoke concentrations we are experiencing based on the fire are certainly not healthy. We're working with the Navy to determine if additional monitoring or additional steps needs to be taken. and Dr. Wilma Wooten can always provide more information on the public health impact of these fires and the corresponding smoke. With that, let's jump into our charts for today. We will start first with a graphical demonstration of the restrictions on indoor activities. Again, you can see here in San Diego County, gyms and fitness center, places of worship, offices for non-essential workers, and the list of essential workers again around the state of California's COVID website. Personal care, including nail salons, massage parlors, tattoo parlors, hair salons and barbershops and indoor malls will all need to cease the indoor components of their operation starting at midnight on Tuesday, and those restrictions will be in place per the state of California until further notice. Our T3 numbers for today, we're reporting 6,542 tests that were performed. Again, that is above our goal, our 5,200 a day goal. It is below our 7-day average, and again, we expect these numbers to come down a little bit in the coming weeks as we refocus and reprioritize what we're doing. You can see our contact tracers and treatments remain in full force. Next, our percentage of positives. Today, we're reporting 419 positive tests out of a total of 6,542. That gets us at a 6% of our test rate positive. That is right in line with our rolling 14-day average. Hospitalization daily census, very modest change yesterday to today, essentially the same with ICU and non-ICU. This is COVID-related hospitalizations are essentially flat yesterday to today. Overall hospital system capacity, you can see there at 3,953 with the COVID in orange, non-COVID above that in blue. And then our ICU current utilization holding steady at 72%, 159 COVID-related, 352 other ICU-related folks. That concludes my section of the report. I will turn it back over to Supervisor Greg Cox.
As we mentioned at the beginning of this briefing, there's some big changes going on in regards to our testing, and to talk to us a little bit about what those changes include, I'm going to call up our Nick Massione, who is the director of our Health and Human Services Agency and is also in charge of our testing. Going on in regards to our testing, and to talk to us a little bit about what those changes include, I'm going to call up our Nick Massione, who is the director of our Health and Human Services Agency and is also in charge of our testing and tracing and treatment division, the T3 division. So Nick, if you'd come on up.
Thank you, Chairman Cox. And as Supervisor Fletcher mentioned, we're bringing on a new testing partner today, a company called Helix, that's going to be providing 2,000 COVID-19 diagnostic tests a day, 7 days a week. I'm pleased to introduce you in a moment the President and CEO of Helix, Mark Stapley, and he'll say a few remarks in a moment. Let me just mention something about Helix, who's a hometown team here in San Diego. They were formed in 2015 and focused on finding ways to improve the health of communities through population-scale diagnostics. The company operates one of the world's largest clinical next-gen sequencing labs, and it's based, as I mentioned, here in San Diego. While bringing on Helix is, in fact, good news for us, I want to be real clear and frank that it's not a testing windfall. Before reaching an agreement with Helix late Friday night, we were facing a real tough situation of needing to close down some of our county testing sites, locations. Well, that's not going to happen now. But the constraints we're feeling were not just uniquely the counties. Our partners, our local hospitals and community clinics, even some of the commercial labs are experiencing supply struggles of their own. And the news story after news story paint a very stressful and distressing picture about the national testing scene. And yes, in San Diego, our ability to test will stabilize because of this new partnership, but we're always looking to bolster our resources. In fact, that's how we found Helix. To best protect the public health, our focus now is moving to faster tests, and as Supervisor Fletcher talked about, focusing faster tests for people who need it most, our highest priority groups. While our county lab is achieving a turnaround of 24 to 72 hours, the waits of 5 or more days for results from other labs are just not acceptable. This renewed focus on priority populations will be a huge part of the T3 mission going forward. Dr. Wooten has spoken and Dr. McDonald has spoken in the past about why these individuals were the most important to test. More information on the priority population groups that you can see on the screen is available on our county website as well as the 211 website. And this one you're seeing is the coronavirussd.com. And it was actually updated as this press conference began. Now, here's where we need the public's help. The highest testing priority for the County of San Diego remains those with COVID-19 infection symptoms or people in high-risk groups that could include healthcare workers, first responders, and other social service employees, and people in essential jobs. Our transport, our folks delivering groceries and providing groceries. Older adults, people with chronic medical conditions, people living in residential in group settings such as long-term care facilities or shelters, and people exposed to infected individuals in places where COVID-19 is high. If you think you need a test, as we always said, first and always check with your medical provider. And if you don't have a medical provider, we're here to help. Call 211 and they will make you and help you get a referral to a medical provider. We know as this pandemic continues, many people are going to need to be tested. And with now this partnership with Helix, more of those priority groups will get their tests and get them even faster. And for those in need of an immediate test, we are operating our walk-in, no appointment clinic at the County Tubman Chavez Community Center located at Euclid Avenue. This Tubman Chavez testing site is actually our busiest site. It's open 7 days a week. It starts at 8:30 a.m. and will continue to serve everyone who's in line before 4:30 p.m. We're going to be adding more of these no appointment sites into the future throughout our county. Now with that, let me turn it over to Mark now to tell you a little bit more about Helix and their testing technology.
Thank you, Nick, for that introduction. We're excited today to announce our partnership with San Diego County to provide COVID-19 testing by leveraging our expertise and infrastructure to help in the fight against COVID for people in need. As you said, Nick, as part of this important public-private partnership, we'll be providing San Diego County with up to 2,000 COVID-19 tests per day. As Nick mentioned, we were founded in 2015 right here in San Diego, and we've got 5 years of expertise operating a clinical lab and collecting and processing samples at massive scale. So we're well prepared for this challenge. We intentionally built our lab from the ground up to be able to be highly automated and scalable, making it a unique fit for the ever-growing demand of COVID-19 testing. We've shifted the majority of our resources to this testing challenge to support this effort. While we continue to service our population genomics customers, we're incredibly focused on COVID-19 testing because it's needed by our community and around the entire nation. We launched our first test, the Helix COVID-19 test, in June in response to the growing demand around the country. It's a PCR-based test. And that includes a full non-invasive collection kit, which is processed in our clinical lab, and results are returned the next day. Let me talk a little bit about our actual test and how Helix achieves this. As I mentioned, in the 5 years that we've been operating our clinical lab, we built a scalable and automated technology, and the infrastructure to support that, and a very strong and talented team. We're continuing to invest in our facility, our infrastructure, and our team, and the technology behind it to service the demand as it continues to grow. Unlike many reference labs who have many different tests or versions of a test, at Helix, our COVID-19 test is highly standardized, and it's only one of 2 tests that we offer alongside our next generation population genomics test. And that's all that we do in our lab, which enables us to create a highly automated end-to-end solution with fast turnaround time. We are, of course, subject to the same supply chain constraints as other labs for some of the components and raw materials used in our testing. But as we designed our test, we intentionally focused on addressing some of those areas where we could avoid the existing choke points in the supply chain. For example, we moved quickly to recognize that not only is an anterior nasal swab, a swab that goes in the lower part of the nose, more comfortable for the individual for testing, but it is actually easier to procure as well. In addition, we're using an alternative transport media that does not require a cold chain. And what that means is it can be shipped and stored at room temperature, at ambient temperature, which makes the logistics of transporting, storing, and dealing with samples simpler, and it simplifies the supply chain massively. And then thirdly, later this summer, we plan on launching a second COVID-19 test. This test will be based on next generation sequencing, which is a massively scalable technology that we have years of experience with right here in San Diego. The test will be based on Illumina's NovaSeq platform, another life sciences company just down the road from us here in San Diego. As well as being more scalable, we believe this will be the most sensitive test on the market, or one of the most sensitive tests on the market. But more importantly, or as importantly and critically, it will have significantly fewer supply chain constraints because it requires a different reagent supply chain than the tests that are being run today. So in closing, I'd like to thank the entire Helix team for launching this COVID test so quickly, and the San Diego County team for working with us to get ready to provide testing in the way we've talked about. We're excited to be part of this important public-private partnership with San Diego County and to make COVID-19 testing available to those who need it most. With that, I'll hand back over to Chairman Cox.